My name is Tyler, if you don't know me, and this is Emily, my partner, if you don't know her. And we're going to be talking about Music Therapy Day, giving you a general overview of what music does and music therapy in general, and then we'll talk about what is music therapy.
The American Music Therapy Association website. So music therapy is a clinical and evidence-based use of music interventions to accomplish individualized goals within a therapeutic relationship by a credentialed professional who's completed an approved music therapy program. So that's like a mouthful, right? And so the reason for that is because we don't want people that aren't credentialed in music therapy to go treating people acting like, they're not qualified, right? And so this is a very specific definition. So just to break it down, so this is clinical, right? So this is evidence-based. It's done in the same way any other research is done. Like it's all clinical research. It's the same kind of things like occupational therapists would do, physical therapists would do, speech therapists would do. It's just using music instead. So the therapeutic relationship is with the client, and all the goals are individualized. So that means that, yeah, there can be group setting music therapy, but it's only music therapy if all the group members have individual goals. And then credentialed professional who completed an approved music therapy program. So that's like your credentialing, right? So it's not just like random people. So we basically, our like little elevator, my little elevator thing, is using music to meet non-musical goals. So all the goals are non-musical. So that's how it separates it from a music educator, like a band director, orchestra director, choir director, that kind of thing.
Their goal is to teach music.
Right, so
we're using music
to teach other things, so like speech or physical rehab. So in order to become a credentialed professional, these are what is required of you. So you have to have at least a bachelor's degree at an AMTA accredited university. So that's what Sam Houston is one of those schools. I think there are 72 in the US that are credentialed through that. And then you also have 1,200 hours of clinical training. So that would be a 6-month internship, usually around that time after you complete your degree, to actually get like the hands-on. It's not book knowledge, but you actually have experience, or you're supervised by somebody who's a credentialed music therapist. And then you take the board certification test through the certification board of music therapists. And we learned this on Wednesday. I didn't know that the certification board people aren't actually the same people as the AMTA. So they kind of check each other, and the people that are giving the music therapy licenses aren't the actual Music Therapy Association. And so I thought that was kind of cool.
I was going to say that our degree is a 4-year degree plus the 6-month internship, totaling the 1,200 hours. So we cannot graduate without this internship at the end of our degree.
And master's equivalency is 3 years, I think. And so that's like if you don't have a degree in music at all. Like I think Zach has a degree in engineering. You can actually take like the credits you need and then do the internship still and get credentialed. But they're moving towards more of a master's level entry, which I think maybe like 15, 20 years from now it'll be a while. The thing is that all the requirements the AMTA asks of us is actually like a lot. And it's kind of crazy to do in 4 years, so they're trying to make it where it's the same amount of, like, we're still getting the same stuff. It would just have 6 years to do it instead of so.
And right now they have continuing education courses that you're supposed to take regularly. I think it's 100 hours a year while you're a professional. Every 5 years. Okay. While you're a professional. Okay.
Treatment, what treatment looks like. So this is the treatment process anytime we get a client. So it starts with a referral. So that could be anybody. That could be a teacher at a school. That could be a doctor or a nurse if you're in a hospital. It could be a parent or a friend. It could even be yourself, like if you have issues with something, like anybody can refer somebody for music therapy. And then I know at least in the school setting that the school districts are required to have a music assessment if they are referred for music therapy. And that's like protection of like a child. If somebody says, hey, get this child assessed for music therapy, the school district has to provide an assessment. They don't have to provide treatment, but they have to at least assess. And then if they're good for music therapy, then they will continue. I've gotten into the real world. It's more of a every like 3 months kind of thing. They'll do an evaluation and then they set new goals and suggest whatever the client needs. And then at the end, there's termination. So that's the main idea for music therapy obviously isn't to have the music with you every time you do something. So it's like if you can walk better listening to the song, you don't want to have to listen to the song a lot, right? You want to be able to do it without the song. And so we have a transfer of gradually taking the music out, so that way they can do it in the regular.
Or if the client isn't responding to the music the right way, that ethically you would terminate the music therapy, or else you're just giving a service that's not benefiting them.
There are some contraindications, so some people wouldn't be good for music therapy. Like if you were a professional pianist and you had like a stroke and you're like working on piano, and I think I'd be kind of angry if I was trying to, and so that wouldn't work for them because it would bring up more bad memories than good memories. But those are just some of the things you think about. And not everybody actually looks for music.
Can I ask a question?
Yeah.
What about hearing impaired folks? It's just not appropriate for them.
There's actually a lot of music therapy through vibrations. They make these boards called, I think they're just vibration boards. But there's some research done, especially with kids. They can sit on this board and they'll play music or play on the board, and they can respond to the music through the vibrations.
And actually, I think it's a very low percentage of people are actually completely deaf. Some people can. It's really just like the speaking range that people can't hear, and so they'll be able to hear something if it's like really low or really high. But yeah, I can attest to. My father's a band director, and he has a music therapist come to his like ensemble, and he'll have like this kid sit down at this board and just like touch it while the band plays, because they can still feel that. And I don't really understand because I can hear, but whenever you play drums and stuff, you feel that too. That's really cool.
Feel free to raise your hand and ask questions throughout if you have a question, but we'll have a segment for questions at the end if you want. But feel free to. Oh, did we go through this? No.
So these are just some places music therapists can work. So school districts, nursing homes, hospitals, rehab centers. That could be inpatient or outpatient. I just observed at the Methodist Hospital in Houston had an inpatient rehab, and whenever they went to outpatient, they would like refer a music therapist there. But the inpatient person was like actually employed by the hospital. Wellness centers. So there's like nursing homes. You think of like elderly. There's nursing homes. There's also hospice. But there's also just wellness centers where like middle-aged people that don't necessarily have anything wrong with them, they just want to like improve the quality of their life. They can go and just make sure that they stay on top of things. When you stop using things, you stop being active in things, like that'll gradually go away. But if you have like a group thing you go to, it's like a YMCA kind of. But you would have like a music therapist there to individually train you. And then also in the home setting, for some people it's not really safe for them to go out. And we see that a lot in special needs. There's some people that just, it would be more trouble in the school, and so they can have better care at home. And so the music therapist in that case would just go straight to the house. Who do music therapists work with? So these are just some examples. The domains that we use are cognitive, communicative, motor, emotional, and social. So cognitive would be like your brain. So that's memory, that's forming thoughts, that's even like more complex. Things would be like setting goals for yourself, self-determination, like making decisions. One of our clients right now are working on like making decisions for yourself. He's always like, no, I want my wife. I was like, no, like you. Even like self-esteem, that kind of stuff can be under cognitive because it's like cognitive thoughts. Coping strategies, being able to form just like rational thoughts, throughout things that go on. So one of those examples would be like short-term memory for like dementia. Communicative. So that could be like through like a TBI is an example up there. That could also be like speech articulation issues. You see in like young kids, things like that. Just any kind of brain damage can cause that. And that could be receptive, like you perceiving speech and communication, and also no, that's not. That's cognitive. What I said was just not as cognitive. So this is the actual physical motor speech. Okay. And then motor is your body movements. So that could be like paralysis. That could be that could be, just like gait and Parkinson's. Range of motion.
Like OTs.
Yeah. So like if you have a stroke, one side is like has trouble, so moving this over here, moving this back, that kind of thing. Just forming strength. Emotional, that's pretty straightforward, but that's a lot of like coping strategies.
Learning to express your emotions and to identify other people's emotions. That kind of goes into the social setting too. It's like, it's kind of reading other people's emotions and socially reacting to that.
Sometimes people like that, other people like it just happens for them. Other people have to learn like social cues. Oh, they're smiling. This means they're happy. Or like the difference between like anger or like sadness. You know, just learning how to read off of that and the emotional, social go like hand in hand with that.
All right, so music in the brain. Music is unique because it affects the brain so much. It can create new neural pathways. So, like for example, if there was a person who had a stroke and that damaged the left part of their brain, which is generally associated with speaking, mostly. Speaking and singing, lyrics are very similar, and music affects lots of different parts of the brain. Like it's also in this left frontal lobe, like speaking is, but it's other places. So you can create those neural pathways and reconnect and learn how to speak through. Is that MIT? There's a melodic intonation therapy, which I'll talk about. And a lot of research on musicians and non-musicians and what the brain is, and the corpus callosum is the tissue that connects the two hemispheres of the brain, and a musician was classified by somebody who who has been studying music since they were before 7 or for 7 years, really young kids, and that tissue there is a lot thicker, a lot more, and so there's a lot more connection between the two halves of the brain, and so music does that. Music connects those two halves of the brain. Music causes strong emotional responses and physiological changes. There's expectation in some whenever you're expecting something to happen next, and there's dopamine and endorphins and other positive chemicals that run through whenever there's an expectation or attention, and there's a release. So, let's see, should we show the video now or let them play some drums?
Well, I just want to say, one thing is, this is just, how music affects you, right? You think of, I always like the Silver Lining Playbook example. In the movie, he had this very traumatic experience that was related to his, like the song that was played at their wedding, like it was like their first dance or something. And so every time he heard that song, it became a trigger for him, right? So that's like the power of music, and music is highly motivating. So you think of strong emotional responses. Like, you hear songs you grew up with, it's like this makes me think of my mom, and so that's like some of the ways that it helps. But
so just
play the video first.
Play the video first.
And then say
This is okay, so let's get some background to the video next. Okay, so basically this is a scene from The Big Bang Theory. I'm sure many of you have seen at least some of it. Not the best show, but it's okay. Sheldon has a problem with completing things, I guess. He gets like really a lot of anxiety whenever something's not
I think that a
completed.
TV show was canceled without it coming to a conclusion. He was like having a panic attack, and so that's what she's trying to teach him how to.
She's going through a therapy with him.
It's quite an impressive layout, isn't it?
Yes.
Let's box it up.
It's back in it.
That's enough. Okay, Sheldon, make a wish and blow out the candle.
Okay. So basically, you can see how frustrated he got whenever he didn't get what he expected. And something great that's about music too is that you can infer from it. It's very like you can make those expectations because as it goes through time. So we're gonna do a small intervention. If you have your drum, you can go ahead and grab it now, or your shaker, G. So basically, we're gonna play And you're gonna, when you hear the word drum, that's when you're gonna hit it. So we're gonna go, let's all play our drum. Let's all play our drum. Let's all play our drum. And then pretend like, I'm not gonna speak it anymore, but I'm gonna clap the pattern, okay? So, let's all play our drum. And now we're going to lengthen it now. We're going to make it a little bit longer. We're going to say, let's all play our drum because it's so much fun. Let's all play our drum because it's so much fun. Play on fun on the last one. Sorry. Let's all play our drum because it's so much fun. Let's all play our drum because it's so much fun. Now I'm just going to clap. Good. And now I'm going to take off some beats at the end, and you're going to have to like anticipate the fun part. Okay? Let's all play our drum because. There you go. Yeah, good. Good. All right. That's another done.
So your brain, after time, it becomes familiar with these things. This is why you hear a song and you don't really care about it, and then you hear it again, like in the mall, and you hear it again in the car, and you don't really care for the song, but after a while you're like, hey, this is kind of good. It's because it's so familiar and so repetitive. So in music, whenever things are repetitive, it causes like this release of dopamine. It's like pleasure, and so you can play like a 4 or 5 off naturally. So if you go like. You go like that, people are gonna wait for it to go like that. And so as much as you don't want to do something, like a kid is gonna be like, I will do whatever it takes to make you finish that.
It's also really frustrating whenever you hear a scale like this. There's no resonance.
And usually somebody sings it.
Ah,
Or hums it because it's like I have to have
that.
And that's all cultural. Like that scale is a Western like music thing. So you go to India, no one's gonna care about that. But because it's not part of their music, it's not ingrained in them as it is here. So now we're gonna look at some specific populations that are commonly seen in the church. So music therapy isn't very old. It's really about 50, 60 years old. And so our idea for this was maybe there would be potential for like contract work in the church or something like that, or some involvement, because we know that there are people with needs and we want to find out what those needs are and meet them. And so these are just 3 kind of generic areas we thought, hey, if music therapy could be in a church setting, this is where it would be.
Yeah, and this is our kind of the people that we would work with. Special needs, people with psychological depression or anxiety, all age ranges will struggle with that sometimes, and then just intergenerational, because we see young kids and older adults in the church, and just bringing those 2 together.
So first we're going to look at the intergenerational. So intergenerational, if you don't know, it's just like young people, old people, older people. Alright, here's just a little bit.
You guys are such a big help. Thank you so much.
Many residents, like Henrietta Turner, have dementia. Time for Children is actually part of their care plan to help reduce anxiety, to help them engage, and to unlock glimpses of lives steadily slipping away.
It's a full circle of life. I think it's really important that these elders are not out of sight, out of mind, that all of us are aging, and all of us will not always age at these perfect ways, and that just because I'm in a wheelchair, just because I'm a walker, just because have dementia, doesn't mean that I'm not human, and that those children are learning that humanness at a very young age. The laughter and the spirit that they have with no particular agenda other than themselves. And so that connection is so powerful, the magic that you cannot bottle up.
So I'm just going to talk about some of the benefits of what intergenerational music therapy would be. There's not a lot of research in music therapy with intergenerational, but there is a lot with just music. So stuff like choirs or just like groups of people coming together and playing instruments together. It's not music therapy per se, a lot of it, but it is like music. And so that's just one of those things that we need more research on. But through the research, what I've seen is like for the younger generation, it allows social interaction. I don't know if you've ever felt like when I was a kid, I was terrified of little people, you know? And so if you have like little kids and they have opportunities to interact with them, they just get this big wide view. Especially this is the series of people, you know, punk 15-year-old or whatever. They think they know everything about the world, but if you get them to talk with some of the older people, like they could really see some new experiences. So through that, they have a better understanding of others and an opportunity to learn from their perspective. They also just have a more positive view towards aging. There's this idea that it's like, oh, this is my generation, but there's really like other generations too that are people, right? So if you have them interact with everybody, it's like really good. So especially for the little ones, one of the things we see a lot of is them working on just like academic, just developmental goals, like little kids, and you have them working with older people. And of course, anybody could work with the little kids, but it's really beneficial for the older people too. So if you can have them in working with these little kids, it just gives them something to do that's like really great.
I was just enjoying your
And so for the older generation, social interaction. When you're in a nursing home, you don't see a lot of people. You know, that's one of our goals right now. I have a client in a nursing home, and one of her goals is just to get downstairs and meet some other people because her food is brought to her room, and she sees her husband, and that is all she sees. Because she doesn't really have a reason to, you know, and like her family doesn't with her, things like that. So as people get older, we've seen, well, first off, we've seen that they choose to be with people they like. So younger people, they're surrounded by people they don't like. You know, it's just nature of how the world works. But whenever you're older, you're kind of like, these are my friends. I'm not going to hang out with people that's just me. And so over time, isolation just kind of happens naturally because of that. You know, and so this is an opportunity for them to have social interaction. Or more positive towards children, that is kind of that fun thing. It's like, there's the possibility to really have influence in their life and to really speak into their lives. If you're an older person, you might not feel like you have influence in their lives, but this is like an opportunity to do that. It's a break from routine, like I said, the having dinner in your room, just kind of not doing anything, your bingo at 3, like why don't you have something else at 3, right? And then also, one of the things I saw that was really interesting was that older people, especially like these people that are grandmothers, have this role of being like an older person. They have this role of, I'm the grandmother, I make cookies and I do all these things. But whenever college age students would speak to them, they related more as like just a person. Like, I don't need to be this grandma figure, I can like actually be a person. And they talked and they felt like, you know, because they just felt like they had more of like an actual identity as a human. So here are some of the goals that like a music therapist would use. So whenever we talk about goals in music therapy, we're talking about the big directional. So they're going increasing or decreasing, right? So we're maintaining. Yeah. So for I think the exception would be like hospice or something like that, where there's you're not going to expect it to get better because they're on hospice, and that's kind of the reality. But you want to maintain it. Or if somebody has Alzheimer's, to maintain it.
hospice means that they're actively declining, so it's just maintaining the highest quality of life that they can.
So some of the examples would be to increase self-esteem, improve mood state, and increase social interaction. So that just comes around that you're not around people. You don't have people pouring into your life, so you're going to feel lonely. You're going to be thinking a lot because you don't have nothing else to do. You're just kind of there. And so this gives an opportunity for them to have like a purpose. And for the younger generation, to improve social skills and improve academics.
Yeah, like the video was talking about that one lady, like as part of her treatment plan to be interacting with kids, and it probably has something to do with, she really loves kids, and you're in the nursing home in a wheelchair, you're very dependent. You can't, it's just an opportunity for her to feel useful and feel.
Yeah, and that was just I just even when I was kind of looking there, you might have heard there was like an instance where they couldn't like a nursing home and a preschool together. everything just worked really well. So some of the musical interventions would be clinical improvisation. So that's kind of like what you did, but clinical improvisation would be like giving people instruments and then giving them a role and having them, play off of each other, copy, call, and receive. And you think about things like that, like what he did, that was like nonverbal communication in you guys. And so for little ones, you're not going to want to talk to them, but because they're little, but you can have communication with them and improve social skills, eye contact, because you have to be looking at him and know what he's doing. And so things like that. Choirs, instrument ensembles. I thought that was something that would be cool for the church setting because it's like that's what happens in the church. And so choir, there was a research study I read that was about people just preconceptions of doing a choir together, and they're like teenagers and older people, and all the younger people were like, the older people are going to be super like sticklers, and they're going to be like, you're not doing this right, and then the older people thought like, oh, I'm going to be like wrong by the young people, but it turned out that it really worked well, and there's a lot of community formed from that, so that's cool. And org playing is it's a philosophy of percussion that's based off of play. And so that's where you get like the keyboard instruments like the xylophones, and you give kids jobs in like a song. We did one at conference that was like, I don't know. But it was like, what was it? It was hot cross buns, and we did these hand motions that was like taking it out of the oven and stuff like that. And it teaches kids, and it creates like a story from it.
And with the work playing, a lot of the time, the kids or adults, whoever's doing it, is kind of getting to arrange the composition. They get to choose a lot of what's going on, a lot of the choices.
And this is kind of a tangent, but org playing is really good for like special needs because you can give somebody that is really high functioning. So you can give somebody that's really high functioning like a melodic pattern, like da 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 da. And if you have somebody who's like lower functioning or just younger in development, you can just give them this hit the drum just the whole time, And so you can kind of do that. And with the intergenerational, you can give the older people like partners. Like here, work with this child, work with this child. That just increases.
So now we'll kind of transition into special needs, and I started to have a little fun with this program after this, so you can, yeah. So. So some goals address the special needs. There's the Joy Ministry, and in this church is a special needs ministry here, and so this is kind of an idea behind this segment where you'll see people with special needs in the church. Some goals that are addressed in music therapy and the special needs population is increasing emotional expression identification. This is what I was talking about earlier. These people sometimes they can't identify other people's emotions and relate to that, or they don't really understand how to express their emotions properly, so they get really frustrated or really sad or something, or they have the build-up, emotional build-up, where then it all comes out at once, and it's really just not good for them. So,
Not socially acceptable.
yeah, it's also not socially acceptable. So another thing is teaching socially valued behavior. So last year I was in our practicum. We have 6 semesters of practicum as a music therapy major, where we go out in the community, or the community comes to us. We have a clinic at our school where we'll actually work and take documentation on clients. And so we had a group of adults with intellectual disabilities come, and we worked on social communication, and so we did a lot of clinical improvisation. I'll talk about the music therapy interventions in a second, but we did a clinical improvisation to kind of, we do like solos. We'd be playing a pattern, and then we do like solos, and so it gives a person a chance to kind of lead, or that's another thing they would lead, but lead solo and then kind of stop soloing, or like look at somebody else and have them start soloing. So it teaches them how to have a conversation without interrupting each other. They like to, people like to talk over the other person. And then in children, especially increasing academic goals, like I'll talk about with those music mnemonics and learning through music, and improving gait. That would be maybe for somebody with cerebral palsy or something, using music therapy to even out their gait, or teach them about their arm swingers.
Yeah, we see music therapy in the schools. It's usually developmental issues, but there are everything, because they're just like little people, right? So they can have, traumatic brain injuries, like they could be in a car wreck and have something like that happen. They could have, I don't know if they know, but like they can just have all sorts of things. So we don't see all of that, but a lot of it is developmental.
Special needs, a lot of developmental, a lot of TBI and stroke, and then even like were you talking about the hearing impaired? That's also a special
I think
needs.
my dad works in CCISD. I think that's like the magnet school for like the and so that's like really cool because that's something we would definitely do.
So the music therapy interventions, I already kind of went through these really quick, but musical mnemonics for memory that helps especially young kids and even adults learn through music. Clinical improvisation, I said there's soloistic clinical improvisation like drum circles like I'm talking about, or divided attention where they're having to maybe focus on the beat that they're playing, but there's another person in the room playing something that's out of time or something like that. They're having to focus and maybe copy you play, I play, what you play kind of thing, back and forth. RAS is rhythmic auditory stimulation. This is a neurologic music therapy technique, which neurologic music therapy is a certification you can get in addition to the MTBC board certified, or music therapist board certified. So there's an opportunity as a music therapist to have a lot of extra initials at the end of your name. You get signed Tyler Smith, MTBC, NMT. But it's the neurologic music therapy is a lot for the medical setting. So this you typically will see with a stroke victim or somebody who has a traumatic brain injury and has lost their ability to walk. They have shuffled gait, or there's Parkinson's disease. They have shuffled gait, or they just have irregular walking in general. But this can be used, with somebody with cerebral palsy also to get that synced up. And there's lots of research that through one session of music therapy they have a more regular gait just from thinking of a song, whatever song they're listening to. MuStim is musical speech stimulation, and this has a lot to do with the singing transferring over to speaking, like I was talking earlier. But more importantly, it's using music and the inflections in the notes. So like, hello, how are you? Something like that. And then you kind of thin out the inflections, so it's more just like, hello, how are you? See, so that's kind of what you would work with that, and that would be working on communication skills with somebody with maybe a TBI or a stroke who's lost their ability to kind of develop sentences cognitively.
I think there's something really special about the safety of music, especially for kids in like clinical improvisations. They might have issues verbally communicating with them. Especially even if they have like a hearing impairment or if they have like a cognitive impairment. Music has the ability to create this structure where you're in an ensemble with a steady beat. You say play something like play a solo, and it's like they can't mess up. You can't, and so that's really I think edifying.
Yeah, I had a lot of fun with it. With the program.
It is so cool. Alright, so psychological needs. There's a lot of psychological needs, but we're right now going to just focus on teenage years. Obviously, it happens. It can happen anytime. It can happen in little kids if they seem like something traumatic. But that was just kind of our thinking. No.
Oh, okay. That wasn't supposed to be that.
Can you back up?
Maybe I backed up.
Like an anxiety disorder. So there's just a lot of, it's very, like this is all kind of vague, but all the disorders are very specific in their own like diagnosis.
Something to just mention real quick is that what a music therapist is not is a diagnostician, so we aren't allowed to do that. We will, like she said, it starts an assessment where we are referred to somebody with some kind of diagnosis. Maybe they're
Yeah, so our goal is to treat their needs. So my special needs semester, I had a boy with like, he was called developmental delay, but he had autism-like kind of symptoms, and his mother kept asking for But we can say that these are his needs and we can make them music, but we can't step over that one. So this is another big thing. This is from the Diagnostic and Statistical Manual. So this is just kind of an overview of anxiety disorders. So they're disorders that share features of excessive fear and anxiety, and I'm going to talk about that a little bit. Behavioral disturbances caused by this. So fear is the emotional response to a real or perceived threat, whereas anxiety is anticipation of a future threat. So they overlap, but they're also different. And so fear is more of that fight or flight, like automatic thing. And then, and that's like escape behavior, is immediate behavior. Anxiety is more like muscle tension and like preparing for something. So that's kind of like when your body's creating a response to something. So the fear is reduced by avoidance behaviors. So this can cause like other things like bad coping strategies. So panic attacks are usually within anxiety at the time of your response, and they're not limited to anxiety disorders, but they're also similar. And panic disorders are one of the specific types of anxiety disorders, but they can also be any. Not any. We need that. So common symptoms of anxiety disorders would be excessive fear and anxiety, behavioral disturbances. So fear, like I said, is a real threat, fight or flight. Anxiety is anticipation of future threat. So this is just kind of what panic attacks are. So panic attacks are abrupt surges of intense fear or intense discomfort. They reach a peak and then they go away after that. So they could be expected or unexpected. So that could be like, they could be triggered by something, or they could be triggered by nothing and just come out of nowhere. And so that's kind of scary. So these are all the symptoms, and I think you have to have like 4. I didn't really look at it, but it's like you have to have like a certain number of these to be like diagnosed with panic attacks. So that could be palpitations, pounding heart, accelerated heart rate, sweating, trembling, shortness of breath, nausea, feeling dizzy, chills or heat sensations, derealization, which is like feelings of unreality, or depersonalization, which is like kind of like an out-of-body experience if you're attached to yourself. Fear of losing control, fear of dying. And so these are all very specific, but it is just a reminder that this is a professional field, and we wouldn't need to say that, and we wanted to have very specific things. The difference, sleeping too much, not enough, weight loss, loss of pleasure, nutritional. So it's very specific. So although that these, like, you might say, oh, I felt that before. These are people that feel this like every day.
Without anything, like, a pile of things.
Yeah, like without reason. And sometimes it can be caused by something. There is a form of PTSD, I can't remember what it's called, and it's like a smaller form that's like, it goes away after a while, and so this is kind of like it lasts a while. And there's not really like a reason for it. There could be a reason maybe a long time ago, like a trigger. So music therapists would use like cognitive, therapy. There's different philosophies of therapy. Some of them are like, let's focus on your past, see what triggered this. Some of them are more like, let's think of, which is kind of where I stand, is the cognitive behavioral, that you feel bad about yourself because you have like a thought about yourself that's a lie. So we're going to fix that lie about yourself, and then you're going to, like, that's not going to be a problem anymore. Right? Or even like expectations of yourself. Like, if I don't get all A's in this, I'm a failure. So then the moment you don't get all A's, you're like, I'm a failure. That's a lie. Right? So major depressive disorder. So depressed mood most of the day. Like I said, sad, empty, hopeless, or irritable. A lot of times in little kids that don't know how to express themselves, it will come out as that angry, irritable, because they don't know how to, I guess, like, and so weight loss in children, that could also be lack of weight gain, like lack of eating. Insomnia or hypersomnia. Psychomotor agitation or retardation. So psychomotor agitation is like this, that could also just be like fidgeting. Retardation, which is like sluggishness. Fatigue or loss of energy, feelings of worthlessness, or excessive or inappropriate guilt. So that's like, it's my fault, I ruined everything, you think that you were. Diminished ability to think or concentrate, or indecisiveness. And recurrent thoughts of death, not just fear of dying, but like actually like thinking of like suicidal thoughts, even like having a plan. So goal areas. So we want an increased mood state, right? We want people to feel better. Increased self-esteem, decreased feelings of anxiety or worry. So these are going to be self-reported. For little kids, you can have what we call like a faces scale, which is like people that look really sad and angry and look happy, and they'll circle with one of those. They might not have a word for it, you know, but you know, adults, they can say stuff like melancholy. It's like, oh, I kind of understand a little better. Yeah, 1 out of 10, how do you feel? And so, a lot of times we work on increasing coping skills. So negative coping behaviors happen a lot. This is nail biting, fidgeting, like yelling, cursing, hitting, even like smoking, drinking, things like this, going out late at night, you're stressed, so you know, do drugs or something. That could be caused by like a coping mechanism. You're trying to get rid of this feeling you have, and you don't know how to deal with it, so you do other things to make you not think about it. That's, you know, why we have all the drug issues and all the sex issues. Really, it's just because it's like, let's get this feeling. So instead, music therapists would do like good coping strategies. We're gonna just, you know, you think of like count to 10, you know, that kind of thing. And so, improving sleep and increasing positive self-statement. So that's like a cognitive thing. That's like, I'm gonna think good things about myself, and if I think something bad, I'm gonna maybe write it down. You can create like homework for people. Like, you thought about yourself, write it down, look at it, and say, is this true? You know, is this really like who I am? Is this my identity, or is this a lie? And then if you can get them to like recognize that, they might not believe it at first, but at least they can know, okay, this is a lie. Do that. Music therapy interventions. So songwriting. Songwriting is a lot of fun. I think it's a lot of fun. So songwriting, a lot of times people will do piggyback songs, but we're going to do kind of an example. We're going to do an example of it. And that's like Mad Lib. Piggyback song, but I had a song for composition when I was in middle school that was like, about a brother cross after among along around that, and at the end I know. You know, because it was like, the melody was in my head. So you get familiar songs with people, they resonate with, you know, pop songs. One of the things as music therapists goes with what works for people. So research has found that music people respond to best, or that they found in like their early 20s, kind of this late teenage, early 20s. So, you know, which you do that age to whatever, however old they are. So like my client's like 90, so we're like looking at like really.
I have a client now who's 92 years old, I think, and so we're like researching songs from the 40s. I'm like, I don't know any of these songs, but I have to learn them.
So lyric analysis would kind of be like the step before that. So that's like looking at lyrics. You can find positive coping strategies. You can also find negative coping strategies. My favorite example of that is the Simon & Garfunkel song, I'm a Rock, which is all about, friends hurt me, I'm going to hide myself in this rock, I'm going to shove myself in and not be vulnerable. And those are bad coping strategies. Also, relaxation exercise. So progressive muscle relaxation focuses on like the muscle group specifically, like tensing.
They tense individual muscles and release them, so they know what that release feels like.
That's a very tangible thing. Guided imagery is more of the like you're on a beach, you're walking. There are like contraindications for those. So progressive muscle relaxation you wouldn't want to do with somebody who can't untense, like in a medical center.
Or it's chronic pain or something.
And guided imagery you wouldn't want to do with somebody who's like schizophrenic, because they're already having a hard time seeing reality. You don't want them to be like dreaming about like the ocean, seagulls, and you know bad things. And so clinical improvisation.
I think schizophrenia is a word that's starting to go away. You're supposed to say people with schizophrenia.
I'm sorry, Tyler.
That's okay. I'm not saying.
Yeah, we're
I'm saying this is very.
So
I just
we,
like
yeah, so
over at conference.
as a goal, we try to,
I think so. Yeah.
as a goal, we try to see like people as people, you know, and you talk about, oh, that autistic child. So no, this is my son. You know, first he's my son. He has autism. He's my son, and so that's kind of the thinking, right?
First person speech. Person first speech. So I would say people with developmental disability. People with schizophrenia.
We're gonna do this one.
So this is kind of on the terms of positive self-statements, or just this is going to be a song that can help you or help a person kind of sing and learn.
You like pizza?
Pizza.
What's your name? Mary. So Mary likes pizza. That's good. We've had pizza.
Yeah. So
Somebody else?
Animals.
I know your name. I'm so sorry, Joe. So you like animals? under like the PT OT treatment because it wasn't insured. And so the PT, they would work on the same goals and just happen to come in, and it, it's just one of those things where like we're still working on it. Maybe we'll see that soon, like as people realize that this is like actually beneficial, it's cost effective. We've seen like in the NICU newborns will like leave, I think it was like a couple days earlier than before if people aren't needing it. That one hospital, we watched a video of in class, they had no, what's the word I'm looking for? Like no pain medication.
Oh.
Like the music did all of it. They were in a relaxed state. They didn't need to be sedated, and that's dangerous to sedate children. Because the music was enough for that.
Yeah, they use music to make the children fall asleep so they perform x-rays or CAT scans or stuff like that. It'll freak out a child where they need to be still, so.
So if you're saving the hospital money, eventually, the word will get around and they'll say, okay, we can cover this with insurance because it's worth it. Anything else?
Well, we would like to thank you so much for coming and seeing us. Enjoy the pizza.